Hey, welcome back, everybody. We're about 20 minutes away from 10 o'clock. Bariatrics is the branch of medicine that deals with the causes, the prevention, and the treatment of obesity. Now, one treatment available is lap band surgery. It is minimally invasive, safe, very effective. How effective? You're getting ready to find out. This morning, we got Dr. Ladd Atkins joining us this morning at Lap Band Center of Oklahoma, and also the spokesperson, Brent Bailey. He's got an amazing story to tell. And when we say amazing, we mean amazing. How much weight have you lost?
Altogether about 175, 180 pounds, somewhere in that neighborhood.
That's a lot of weight.
Yeah. It's a whole person plus.
Yeah. And you say you wake up in the morning sometimes and just...
I keep thinking I'm going to wake up and I'm fat again. This whole thing was a dream, and it's really not happening. And I've never been able to shop in a normal store or anything like that, but now I do, and it's really an amazing feeling.
It's a good dream too, isn't it?
Yeah, it really is.
Yeah. Dr. Atkins, let's talk about lap band surgery and exactly what it is. There's a lot of questions people have about exactly what is it, and when we say minimally invasive, it doesn't look like it.
Right. Well, minimally invasive means laparoscopic surgery or camera surgery, which entails also an outpatient surgery. But once we place the camera into the abdomen through a small incision, we're able to place the lap band, which is a silicone adjustable or inflatable band around the stomach, which limits how much you can eat at one sitting, and effectively reducing what you eat at one time and keeping you satisfied and fulfilling. And you end up losing about 1 to 2 pounds a week. Or 50 to 100 pounds in a year.
That's amazing. Now, I would assume not everybody is a candidate for this surgery.
No, it's ideal candidates are people with a BMI or body mass index of 30 and above with a comorbid condition such as diabetes, high blood pressure, or sleep apnea, or anybody with a BMI of 35 and above. That's commonly anybody that wants to lose 50 or more pounds or even over 100 pounds.
And that was kind of your case. I mean, you also had diabetes.
Right.
You were suffering from a lot of health problems.
Yeah, I had constant joint pain in my knees. Back was hurting all the time. I was diabetic, was on blood pressure medication, and after about 3 weeks after the surgery, I was completely off all my medication, and the more weight I lost, my knees and my back started to recover, and everything reversed.
No longer had to worry about the diabetes, no longer had to take the high blood pressure medicine.
Yeah, all of that was gone, and everything was really, reversed. Yeah.
Now, I would assume this is not a cheap surgery, but insurance in some instances does help out.
Yeah, many insurances cover it completely, especially with obesity on the rise. More insurances are picking it up. We check it on each patient's individual basis and the requirements of their insurance, but also there's a cash price that patients are oftentimes willing to pay to change their lives.
Oh, I'm starting to say, if it makes that big of a difference in someone's life, I can't imagine all the medication that you're having to purchase and all the other things that go along with it. It's probably pretty expensive.
Absolutely, and I know my insurance didn't cover it. I was a cash patient, but it was the best investment I ever made in my life. I mean, I grew up bigger than everybody else my whole life.
Well, you're a tall guy anyway.
I'm 6'5",
yeah.
right? So, but at the day of my surgery, I was 370 pounds. But before that, I had ballooned up to about 405, 10, somewhere in that neighborhood. So, all the other health conditions that come with that, the cash payment was an option.
The least thing that you were worried about.
That's right. That's right.
Yeah, and I would imagine that you probably, as a spokesperson, naturally you're going to recommend it. But you actually feel that way. I mean, you feel strongly about lap band surgery.
Yeah, we were talking beforehand. I went to Six Flags down in Dallas and couldn't get on any of the roller coasters or anything with my son, and that was what really hit me. I knew about the health conditions, but it wasn't enough to motivate me. But when I couldn't enjoy my own son anymore, that was when I decided I got to get serious about this and I had tried everything. I'd tried Nutrisystem and Weight Watchers and all those things, and it just didn't work. I'd lose 10 pounds and put it all right back on, and especially around the holidays and things like that. This was an option that was permanent.
Yeah.
And that's,
these are stories you probably hear all the time too,
Right.
aren't they?
Yeah, permanent weight loss option. I mean, it's a surgery, but as far as the weight loss surgeries goes, by far the safest, outpatient, less recovery, and patients are doing well. So even patients we did before Christmas that we've seen this week have lost, anywhere from 20 to 40 pounds already. So
amazing. Well, listen, people are probably wondering, what are they doing with those blankets in their laps?
it's cold in the studio.
Well, you guys brought those because we were talking about spread the warmth, Frank.
That's
spread
right.
the warmth, and you guys were kind enough to bring these in this morning. Certainly appreciate it, and they'll be distributed to the folks who certainly need them. So. Thank you guys very much for coming in. Hey, congratulations.
Appreciate that.
That's
Thank
pretty
you.
exciting stuff. Dr. Atkins, thank you, sir.
Thank you very much.
As well. To find out more, Lap Band Center of Oklahoma. They're located at 2408 East 81st Street, 6th floor, Pinnacle Specialty Hospital, 918-392-2806. And you can also go online to find out a lot more information, lapbandcenterofoklahoma.com.